Hello, and welcome to the conclusion of Chapter 4. In this lecture, we'll discuss the forearm, elbow, and distal humerus. So remember, the bones of the upper limb can be divided into 4 main groups: the hand and the wrist, the forearm, the humerus, and the shoulder girdle. And we've already discussed the hand and the wrist, so now let's discuss the forearm and the distal humerus. And the distal humerus is relevant now because that includes the elbow joint. We'll discuss proximal humerus, so here, and the shoulder girdle in Chapter 5. So in this presentation, we'll discuss the shape and the structure of each of the bones and their joints. So here's an example of a right forearm. So remember, the radius is a lateral bone on the same side as the thumb, remember, and the ulna is the medial bone. And as we've learned in the previous unit, the radius and the ulna articulate or join with each other at the distal radio-ulnar joint here. So distal radio-ulnar joint would be at the wrist. But as we'll see, they also articulate at the proximal radio-ulnar joint here near the elbow. Remember, these two joints allow for the rotational movement of the wrist and the hand. So when we're pronating our hand, those two joints are responsible for that motion. And they are both trochoid or pivot joints. Okay, let's review some anatomy. And let's begin distally and take a look at the styloid processes. So you can see here and here. These are small projections. Remember, a projection is a bump on a bone located at the extreme distal ends of both the radius and the ulna. The radial styloid process can be palpated on the thumb side of the wrist joint, and it extends more distally than the ulnar styloid process, which you can see here. So the radial styloid process is more distal than the ulnar. However, when I look at my own wrist, my ulnar styloid process right here is much more prominent. I can feel it, I can see it very easily, especially when your hand is pronated. And remember, that's the medial side of my wrist. Next, let's look at the ulnar notch. This is a small depression on the medial aspect of the distal radius. So the ulnar notch is a depression on the distal radius. The head of the ulna, which you can see here, fits into that ulnar notch, and that helps form that distal radio-ulnar joint. Again, you can see and feel the ulnar head and styloid process pretty easily when your hand is pronated. So remember, the head of the ulna is distal, but the head of the radius is actually proximal, near the elbow joint. The long midsection of both the radius and the ulna is referred to as the body or the shaft. Interestingly, the radius is the shorter of the two bones, and you can see that pretty clearly here. It's shorter than the ulna. And when we pronate our hand, the radius actually rotates around the ulna with those two trochoid or pivot joints. Again, when we look at the proximal radius, we can see the head and the neck. And the neck is a tapered, kind of constricted area directly below the head. The rough oval process on the medial anterior side of the radius, just below the neck, is called the radial tuberosity. Now, we'll label these parts in lab with our bones, but just remember, proximal radius is head, neck, and radial tuberosity. So let's identify the parts on the proximal ulna on the next slide. Okay, so the ulna, which remember is slightly longer than the radius, is the primary bone involved in the formation of the elbow joint. This part right here, which we'll talk about in a second, on the proximal ulna, articulates with the distal humerus and assists in a hinge-like movement. So there are two processes on the proximal ulna that I want you to be familiar with. First is the olecranon process, seen here, and the way it's labeled on your diagram is slightly deceiving. I want you to think of this whole part as the olecranon process, okay? And second is the coronoid process, seen here. And if you kind of make a C with your hand, you can kind of remember these two processes. So the top process is the olecranon, and this beak-like process at the bottom is the coronoid process. The olecranon process can be easily palpated on the posterior aspect of your elbow joint. Again, when you feel your elbow in the back, this is what you're feeling. The lateral aspect of the coronoid process is called the radial notch. And guess what fits in the radial notch? Yes, the radial head. This articulation forms the proximal radio-ulnar joint. So let me say that over again. The radial head fits in the radial notch on the ulna, and that makes up the proximal radio-ulnar joint. Again, it's this articulation along with the distal radio-ulnar joint that allows for the rotation of the forearm when we pronate our hand. Again, during the act of pronation, the radius crosses over the ulna near the upper third of the forearm. Okay, the medial aspect of the coronoid process is called the coronoid tubercle. So the radial notch is the lateral aspect of the coronoid process. The medial aspect is the coronoid tubercle. And let's actually go back one slide to look at that. So you can see here's the coronoid process. Here's the radial notch where the head of the radius articulates. And here is that coronoid tubercle. Okay. The large concave depression or notch that articulates with the distal humerus is called the trochlear notch or the semilunar notch. And I think it's helpful if you can remember both terms. Trochlear notch is more common. Again, this depression articulates with the distal humerus and helps form that hinge-like joint. Okay, next, let's discuss the parts of the distal humerus that help make up that elbow joint. And remember, we'll discuss proximal humerus next in Chapter 5. Okay, so first, notice the long midsection of the humerus is called the body or the shaft. And the distal end of the humerus has a rounded surface, and we refer to this as the humeral condyle. So here's your body or your shaft, and then this whole rounded end is called the humeral condyle. Okay. The portions of the humeral condyle that articulate with the radius and the ulna are divided into two parts. You can kind of see them here, so we'll talk about each. The trochlea is the medial aspect of that humeral condyle. And I want to draw or circle the trochlea. It's this whole structure right here. Okay, this whole thing is the trochlea. So remember, the trochlea is medial on the distal humerus. And then there's the capitulum. And the capitulum is here. Okay, the capitulum is the lateral part of the humeral condyle. The trochlea, again here, which literally means pulley, is shaped like a pulley or a spool. And the trochlea actually has two ridges with a smooth, depressed center. So here's kind of one ridge of the trochlea, and here is the other ridge of the trochlea, and then in the middle is that a smooth groove or depression. And that groove or depression is called the trochlear sulcus or trochlear groove, which I've labeled here. Okay, and again, we will look at this in lab. So the trochlear sulcus, this depression on the trochlea, actually appears circular on a lateral elbow, and we'll look at that shortly because that will be important for us to note when we're positioning. And please note, this diagram is mislabeled in your textbook. So please refer to the diagram here when you are checking your own diagrams. And I've also uploaded a picture of this in Canvas under the diagram keys. Again, your textbook is not accurate. Okay, the trochlea, one last thing, is remember medial, and it articulates with our ulna. The capitulum means little head, and it's again located on the lateral aspect of the distal humerus, and it articulates with the radial head. I remember capitulum because it is the cap on the radial head, capitulum cap. The capitulum is slightly smaller than the trochlea, and it becomes important again when we look at a lateral elbow, which we'll do in the next presentation. Okay, next, let's look at the epicondyles. Epi means above. So remember, the rounded projection at the distal end of the humerus, this whole thing is the condyle. And then you have two projections, which also are condyles. They stick out, they're bumps on the bone, but they are above the humeral condyle, so we call them epicondyles. The lateral epicondyle is smaller and of course found on the lateral aspect of the distal humerus, and it's actually located kind of right above the capitulum. The medial epicondyle is much larger and more prominent than the lateral epicondyle, and you can feel the medial epicondyle when you feel the medial aspect of your elbow joint. In a true lateral position of the elbow, again, we'll look at that in the next presentation, the epicondyles should be directly superimposed over each other, and they will be proximal to the capitulum and the trochlea. And again, we'll look at that in the next presentation. There are several depressions on the distal humerus that I want you to know. There are two shallow depressions on the anterior surface. The coronoid fossa, remember fossa meaning depression or, groove, and the radial fossa. As you flex or bend your elbow, the coronoid fossa receives the coronoid process. The radial fossa receives the radial head. So the fossas have their name because of the parts of the radius and ulna that articulate with them when you bend your elbow. There is a deep depression on the posterior aspect of the distal humerus, and it is called the olecranon fossa. And you can't see that on this diagram, but the olecranon fossa is very deep and it's on the back of the distal humerus. We'll look at it in a different slide. When your arm is fully extended or out straight, not bent, the olecranon process, remember that's the back here of the ulna, fits into the olecranon fossa. And again, I'll point that out on a different slide. There are also several important fat pads in this area that we'll need to know as well. Let's pause here. We'll pick up with the lateral elbow in part 2.